Hello everyone, I'm Dr. Suresh, Senior Consultant Maxillofacial Surgeon from Gnathos Facial Surgery. Often, if someone meets with a facial injury, now you should ask who is the treating doctor. Most of the hospitals may not have an experienced, competent maxillofacial surgeons. So, as a rescue team, some other specialty surgeons may operate on these patients. If some specialty surgeons who are generally trained in any other trauma or any other areas may not have an exclusive knowledge or skills to treat the maxillofacial injuries. So, in that case, the recovery will be slow. The biggest challenge is the functional recovery of the jawbone. Usually, when jawbone fracture happens, the teeth are disaligned. So that affects the chewing of ability. If someone doesn't have a complete knowledge of the jawbone anatomy and the alignment of the teeth, in spite of that, if you start fixing the facial bone fracture, the chewing ability of the patient is affected. So always ask an experienced maxillofacial surgeon to treat the maxillofacial injuries or the facial bone trauma. Who is a maxillofacial surgeon? Maxillofacial surgeons are only trained in facial trauma management exclusively. So they have a complete knowledge of alignment of the teeth, the functions of the jawbone, the functions of the nose, the aesthetics of the face and the skin. So they are the competent surgeons who can give a very scarless surgeries where they can hide the scars without any scars on the face. At the same time, balance the functional issues like the chewing ability and the mouth opening ability of the patient. Usually, these patients are put on something called as IMF, where the upper jaw and lower jaw are tied together and the patient is allowed to have only liquid diet for maybe a 10 days or even more than 10 days. With modern advances and exclusively trained maxillofacial surgeons who has got a complete knowledge of maxillofacial injuries will be able to fix these jawbone fractures and immediately after surgery, within 5 hours or immediately after 5 hours after the surgery, the patient will be able to have a normal alignment of the teeth. At the same time, the patient will be able to eat normal soft diet after the surgery. There is no need for someone to fix on something called as tying of the jaws or IMF. So if you are happen to fall in any hospital or any sustained injury, ask the hospital authorities or ask the concerned doctors who is the specialist who is treating the facial bone injuries. If possible, always opt for an experienced trained maxillofacial surgeon to treat maxillofacial injuries. If you find this information valuable, kindly share with the people who are in need. Thank you for watching this video.